Hi. All of my patients know about the test coronary calcium scoring test. This is a test that I rely on better than any other test to predict things like acute myocardial infarction, heart attack, which can kill you or damage your heart. It can also determine the likelihood of long-standing heart disease that can end up one day requiring bypass surgery, stents, or even leading to small vessel disease. It can answer a question regarding a patient's potential genetically for heart disease. When there's history of heart disease in the family, it is not necessarily genetics. So this test, for a very small price, very minimal radiation exposure, can answer a lot of the questions that the more conventional testing, including nuclear stress tests and other form of what's called ischemia testing, cannot test. So when I get a calcium scoring test, it's typically anybody between the ages of 40 and forever if you're a male, and typically for a woman, probably 45 and up. Certainly if there's extenuating risk factors or extreme family histories, we may do it earlier, or maybe not do it as frequently if there's truly no evidence of disease, no risk factors, etc. So the reason I'm pointing to this is that we've had a great experience this summer in the office. I had 2 college students working with me. If you see my prior YouTube videos, you'll see them, Matt and AJ. Matt is a pre-medical student. AJ is in business school in NYU. Together, we put together a flow sheet, a spreadsheet, looking at all the calcium scoring tests and being able to determine based on other risk factors, just like inflammatory markers, cardiometabolic markers like diabetes, prediabetes, triglyceride levels, insulin levels, lifestyle, including exercise, smoking, diet, BMI. And when we put all that in, we actually were able to determine a risk list of people that are at higher risk of having an acute heart attack or an acute event versus people that are less at risk. Why is this so important? Well, it's obvious why it's important to know if you're likely to have a heart attack, but it's very actionable. So with all that data, not only was I able to pick out people that were at a higher risk, and we found several patients that actually needed intervention, but we were able to also see people that maybe had thought they were in a stable condition, but we found that the calcium scoring was advancing over the years. And in doing so, the risks go up. So the information is really power, because with that information, we're able to assess and focus on potential risk for this heart attack. If anybody's ever known somebody that's had a heart attack, typically they don't have symptoms beforehand, especially if it's a younger person, because the heart attacks don't come from arteries that are already blocked. They come from areas that maybe have some plaque, and that plaque can get inflamed, and that plaque can rupture. And in a very quick period of time, you become a blocked artery that was once just a mild plaque that would not even have been noticed on angiogram or other testing. So again, I'm trying to speak to you like I do in the office. If you have not had a calcium scoring test and you're a man between the ages of 50 and 80, then we need to get that done. If it's been more than a couple of years and you did have a positive score, then we need to repeat it. I'm going to be talking to all of you as you come back for your yearly exams and we interact, but it still is, in my mind, very disappointing that a coronary artery calcium scoring test is not used more broadly in the cardiovascular community. I have my own feelings as why that's the case, but just to say that there's this great piece of data that is very easy to acquire that can really set the whole table for where you're heading from a cardiovascular standpoint, both good or if you have increased risk. And that's something we should all know about. So if you're not my patient, you should ask your physician about a coronary artery calcium scoring. And if you are my patient, then we're definitely going to talk about it. And as I said, please bring it up to me. I love to talk about it. This is a life-saving test. If you go to YouTube, there's a lot of information on coronary artery calcium scoring test. There's a lot of information in the NIH's website on PubMed. So low cost, low radiation, lots of good information to act upon. Some people, it rules them out for life. Some people, it says you have risk, we need to work on it. Either way, power is knowledge. Have a great day.